You see these images of nurses on the front lines working so hard to save lives during this pandemic, and you might think nurses are really needed right now. But that is not the case for hundreds who are facing a different kind of crisis. They have lost their jobs.
But it was a little bit of a shock to be told you're furloughed.
Paula Cunningham says being a nurse who can't work during a pandemic is a hard pill to swallow.
Anytime a nurse can't work, I feel that we're born to do this.
Paula is unemployed for the first time in her 35-year nursing career.
We want to be caregivers, and when we're not giving care, there's an empty feeling. There's a void.
Having worked as an operating room and transplant nurse at UCLA Medical Center for 10 years, she's now in charge of the OR at La Jolla Cosmetic Surgery Center, which closed mid-March under the statewide ban on elective and non-emergency surgeries. Nurses at hospitals are affected too. They've rallied to protest the layoffs and furloughs of more than 100 nurses at Palomar Health and Tri-City Medical Center combined. Nationwide, there have been thousands of cutbacks.
Your heart breaks because, many incomes are dependent on work.
Paula, a mom of 4 kids with 2 in college, says navigating the financial strain can be stressful.
As a family, we sat down, discussed what it meant for me not to have an income, and laid out a budget.
She's grateful her husband is still working, and in an ironic twist, he is the one who must sometimes wear PPE at his job at Rady Children's Hospital.
He is not in patient care. He's an engineer, and if he does have to go into any patient care areas, then he would suit up.
A stay-at-home mom for the first time in her life.
You usually see me like this.
Paula is wearing a different hat these days, and the first thing she told her kids was this:
Mom's home, but I am not the maid.
She's using her efficient OR skills to run her household where everyone has a job.
We take turns rotating, cooking, cleaning. This is the school schedule.
She's staying useful.
I sew, so I'm making masks for friends and neighbors. I also have a brother and a sister that are ER pediatricians.
And for her kids' public school, she helped raise $25,000.
And I'm looking forward to our Zoom auction event. A nurse is a nurse is a nurse. We're always gonna try to find a way to help people.
As she looks forward to the day when she can work again.
The hope is that when we get up and going, we'll be working very hard and we'll be working longer hours, but we've got to wait for safety. We've got to know that there will be no negative repercussions. In the meantime, I'm managing my household, which is a lot of work.
It sure is. I thank Paula for sharing her story. A lot of nurses, they didn't want to talk. They were too devastated and too afraid their employers would be unhappy.